गुड इवनिंग एवरीवन। और जे की पाठशाला यूट्यूब चैनल में फिर से आप सभी का हार्दिक स्वागत है। आज हम वेटनरी पैथोलॉजी का जो यूनिट 2 है उसका जो कोर्स टाइटल है सिस्टमिक वेटनरी पैथोलॉजी, जो पेपर 1 में कंसिडर होता है, उसके बारे में जो मोस्ट इम्पोर्टेंट क्वेश्चन है उसके बारे में हम चर्चा करने वाले हैं। जैसे कि हम हर बार देखते हैं कि पहला पार्ट हमारा ऑब्जेक्टिव रहेगा और दूसरा पार्ट हमारा सब्जेक्टिव रहेगा। और इससे पहले वाले जो वीडियो है यूनिट 1, 2, 4 और 5 जो मैंने अपलोड कर ऑलरेडी यूट्यूब पे अपलोड कर चुका हूँ मैं, उसके बारे में अगर किसी को वीडियो एक्सेस करना है तो उसके लिंक मैंने यहाँ पे डिस्क्रिप्शन बॉक्स में डाल दी है, वहाँ से आप उसको एक्सेस कर सकते हो। सबसे पहले पार्ट 1 ऑब्जेक्टिव, जिसमें सबसे पहला हमारा जो क्वेश्चन नंबर 1 होता है, गिव स्पेसिफिक वर्ड और द टर्मिनोलॉजी फॉर द फॉलोइंग। उसमें सबसे पहला क्वेश्चन है इंक्रीज द एक्यूमुलेशन ऑफ द सेरेब्रोस्पाइनल फ्लूइड, जिसको CSF बोलते हैं, इन वेंट्रिकुलर सिस्टम, मतलब ब्रेन के अंदर जो वेंट्रिकुलर सिस्टम होती है वहाँ पे जो CSF का एक्यूमुलेशन होता है उसको हम क्या बोलते हैं, हाइड्रोसिफिलस बोलते हैं। सेकेंड क्वेश्चन है प्रेजेंस ऑफ द एयर इनटू द प्लूरल केविटी, उसको हम बोलते हैं न्यूमोथोरेक्स। थर्ड नंबर क्वेश्चन है इन्फ्लामेशन ऑफ द सेंसिटिव लेमिनी ऑफ द हुप, उसको हम बोलते हैं लेमिनाइटिस। टर्निंग ऑफ द आईलिस causing the corneal irritation is known as trichiasis, TRICHIASIS। फिफ्थ नंबर है इंट्रावास्कुलर एलिवेशन ऑफ द नाइट्रोजीनियस वेस्ट प्रोडक्ट, इट इज नोन एज एजोटेमिया। Sixth number है acute tubular necrosis resulting from the ischemia or the toxic insult, that is known as nephrosis. Seven number है inflammation of the hair follicle, that is known as folliculitis. Eight number है parasite which are the found into the heart of the dog, that is known as Dirophilaria immitis, which are the parasite present in the right ventricle of the heart. 9 number है break in the continuity of the bone due to the trauma or the accident, that is known as fracture. 10 number question है कि parasite which are the in horse causing the arthritis, means arthritis of the anterior mesenteric artery, जिसकी वजह से हॉर्स के अंदर कोलिक भी होता है, तो पैरासाइट का नाम क्या है, that is the Strongylosis vulgaris. 11 number question inflammation of the vertebra, that is known as spondylitis. 12 number question inflammation of the palate, that is known as lymphus. 13 number question है pneumonia caused by the fungus in brooding cheek, that is known as brooder pneumonia, or that is also known as mycotic pneumonia. 14 number question है twisting of the intestine on its own axis, that is known as torsion. अगर twisting of the intestine on its mesenteric axis है, that is known as volvulus. अगर telescoping of the intestine है, मतलब एक intestine दूसरे intestine में इनवेजिनेट हो रहा है, उसको बोलते हैं हम intussusception. तो you remember the torsion, intussusception, and third is volvulus. 15 number question है failure of the alveoli to open and contain the air, that is known as atelectasis. 16 number है inflammation of the ear, that is known as otitis. 17 number question है leukocytosis with many immature cell, that is known as shift to left. 18 नंबर क्वेश्चन है डायलेशन ऑफ द ब्रोंकियल लूमन, मीन्स ब्रोंकियल लूमन का डायलेशन होना, उसको इक्टेसिस मीन्स ब्रोंकियो इक्टेसिस बोलते हैं. स्टोन फॉर्म्ड इनटू द सलाइवरी ग्लैंड, दैट इज नोन एज साइलोलिथ. सलाइवरी ग्लैंड के अंदर स्टोन, दैट इज साइलोलिथ. 20 नंबर क्वेश्चन है फीमेल काफ विथ एरेस्टेड डेवलपमेंट ऑफ द सेक्स ऑर्गन एंड द बीइंग द ट्विन ऑफ द परफेक्ट मेल, मीन्स मेल और फीमेल दोनों साथ में जब जन्म होते हैं कोई भी पशु के अंदर, तो उसको हम प्री मार्टिन बोलते हैं. वहाँ पे मेल और फीमेल का दोनों का जो डेवलपमेंट होता है सेक्सुअल ऑर्गन का, वो एरेस्ट होता है. 20 नंबर क्वेश्चन डायलेटेड एंड द टोर्ट्यूस वेन, दैट इज नॉन एज वेरिकोस वेन. 22 नंबर सॉफ्टनिंग, डिकेइंग एंड द डिस्कलरेशन ऑफ द इनेमल ऑफ द टूथ, दैट इज नॉन एज डेंटल कैरीज. 23 number question है resorption of the dead fetus without infection within the uterus, that is known as mummification. See, without infection है, that is known as mummification. जब मेसरेशन होता है तो वहाँ पे क्या सिर्फ हड्डियाँ ही हाथ में आती है. जब आप एनिमल के अंदर पर रेक्टली देखते हो तो हड्डियाँ ही मिलती है, लेकिन वहाँ पे इन्फेक्शन होता है. ममिफिकेशन में इन्फेक्शन नहीं होता है. यू रिमेंबर ट्रू फॉल्स में भी काफ़ी बार पूछा जाता है. 24 number refractile inclusion seen in erythrocyte of the horse treated with the phenothiazine, that is known as Hange body. Now second part, second question number, fill in the blank of the following. उसमें सबसे पहला है inflammation of the mammary gland is called as mastitis. Second number, again the break in the continuity of the bone due to the trauma is called as fracture. Fill in the blank is accumulation of the edematous fluid into the thoracic cavity, that is known as hydrothorax. Fourth number, needles is needed for the formation of fill in the blank in urinary system. needles stone बनने के लिए चाहिए, means stone या calculi. Answer is stone or calculi. 15 number question, azoturia is also called as Monday morning sickness. Decrease, 6 number, decrease in number of the leukocytes is called as leukopenia. Fill in the blank type of the blood is more dangerous, means frothy blood जो है वो gaseous blood से सबसे ज़्यादा dangerous है, means frothy blood है वो more dangerous है. 8 number, fill in the blank, inflammation of the spinal cord at the brain, that is known as encephalomyelitis. 9 number question, fill in the blank is a phagocytic cell present in the central nervous system, that is known as microglia. 10 number question, nutmeg liver is seen in fill in the blank cirrhosis, that is the cardiac or the central cirrhosis. 11 number question, fill in the blank is a defect in which there is abnormal connection between the nasal cavity and the mouth, that is known as cleft palate. Fill in the blank is dilated and the tortuous vein, that is known as varicose vein. Inflammation of the bone is termed with usteitis. ओस्टाइटिस, OSTEITIS. इन्फ्लामेशन ऑफ जॉइंट को हम आर्थराइटिस बोलते हैं, और जॉइंट में भी जो इन्फ्लामेशन ऑफ शोल्डर जॉइंट है उसको हम ओम आर्थराइटिस बोलते हैं. इन्फ्लामेशन ऑफ द हिप जॉइंट जिसको हम कॉक्साइटिस बोलते हैं. इन्फ्लामेशन ऑफ द स्टाइफल जॉइंट जिसको हम गोनाइटिस बोलते हैं, GONITIS. ये रिमेंबर करना, गोनाइटिस. 15 number question, bleeding from the nose is called as epistaxis. Fill in the blank is the presence of the stone in gall bladder, that is known as cholelith. Fill in the blank, 17 number question, presence of the pus in urine is called as pyuria. 18 number, decrease in number of the neutrophil is called as neutropenia. 19 number, inflammation of the nasal mucosa is called as rhinitis or coryza. 20 number, fill in the blank emboli are the common during the fracture of the long bones, that is known as air emboli. 21 number, narrowing of the bronchial lumen is known as bronchiostenosis. Narrowing means stenosis होना, dilation means ectasis होना. 22 number, inflammation of the vein, that is known as phlebitis. 23 number, distension of the uterine tube by the clear fluid is called as hydrosalpinx. 24 number, blue baby condition occur in fill in the blank type of the development anomaly of the heart, that is due to the atrial septal defect, ATRIALSEPTAL defect, DEFECT. 25 number, fill in the blank hormone regulate the metabolism of the calcium and the phosphorus level in blood, that is known as PTH, that is parathyroid hormone. 26 number, opacity of the lens, that is known as cataract. 27 number, failure of the incomplete descending of the testes into the scrotum is termed as the cryptorchidism. CRYPTORCHIDISM. 20 number, fill in the blank is cystic dilation of the salivary gland into the floor of the mouth cavity, that is known as ranula. 29 number, stiffening of the muscle in equine azoturia, or also known as Monday morning sickness, is due to the accumulation of which type of the particular substance, that is the lactic acid. 30 number, funiculitis is inflammation of, फनिकुलाइटिस क्या है, इन्फ्लामेशन ऑफ द स्पर्मेटिक कॉर्ड है, जबकि फोलिकुलाइटिस जो इन्फ्लामेशन ऑफ द हेयर फॉलिकल है, हेयर फॉलिकल. 31 number, inflammation of the glans penis, that is known as balanitis, BALANITIS. After the objective, after the fill in the blank, now we will move toward the state the true and the false question. First question, polycythemia is increase in the circulating platelets. False. It is actually increase in the circulating RBCs. Second number, deficiency of the cobalt cause the macrocytic anemia. That is true. Third number, degenerative shift to left is indicate the increased activity of bone marrow. False. वहाँ पे decrease activity of bone marrow होता है. That is why third number is false. Fourth number, eosinophilia is seen in parasitic infection. True. Abnormal fifth number, abnormal shape erythrocyte is called as poikilocytosis. That is true. Sixth number, seminoma is tumor of the adrenal gland. False. Actually, it is tumor of the testis. Seven number, increase in the thickness of the stratum corneum is नॉन एज हाइपरकेरोटोसिस. फॉल्स. एक्चुअली स्ट्रेटम ग्रेन्युलोसम का जो लेयर का थिकनेस होता है उसको हम हाइपरकेरोटोसिस बोलते हैं. 8 नंबर, माइक्रोग्लिया आर द फेगोसाइटिक सेल ऑफ द सेंट्रल नर्वस सिस्टम. ट्रू. ग्रेन्युलोमैटस टाइप ऑफ द न्यूमोनिया इज सीन इन द ट्यूबरकुलोसिस. दैट इज a true. 10 number, twisting of the intestine on its long axis, that is known as volvulus. False. Actually twisting of the intestine in its long axis उसको हम torsion बोलते हैं. Twisting of the intestine on its mesenteric axis उसको हम volvulus बोलते हैं. 11 number, distension of the uterine tube by the clear fluid is called as hydrosalpinx. That is known as true. 12 number, abnormal dorsal curvature of the spine is known as kymphosis. Means dorsal curvature उसको kymphosis बोलते हैं. लेटरल कर्वेचर उसको हम स्क्वाइसिलियोसिस बोलते हैं और वेंट्रल कर्वेचर होता है उसको हम बोलते हैं लॉर्डोसिस. LORDOSIS. किम्फोसिस, स्क्वाइलियोसिस एंड द लॉर्डोसिस. यू रिमेंबर दिस थ्री टर्मिनोलॉजी. 13 number question, neoplastic proliferation of the leukopoietic tissue in the blood is called as leukomoid reaction. False. It is known as actually leukemia. 14 number question, death in acute blood, it is due to the asphyxia. That is the true. 15 number, luxation is displacement of the lens of the eye. That is true. 16 number, telangiectasis means dilation of the hepatic sinusoids. True. You remember the fill in the blank means dilation of the hepatic sinusoid काफी बार पूछे जाती है तो वहां पे आपको लिखना है telangiectasis. Ictasis. Telangiectasis. You remember like that. 17 number question, in rabies the negri body are seen in the cytoplasm of the neuron. That is known as particular intracytoplasmic inclusion body. और ये आंसर है true. 18 number, phlebolith are the usually found in kidney. False. Actually it is found in vein. 19 number question, green stick fracture is seen in young animal. That is particular true. In myelopathistic anemia, blood picture is the normocytic normochromic. True. Hyperthyroidism leads myxedema. That is known as true. Size of the erythrocyte gradually decreased during the maturation into the bone marrow. That is answer is true. 23 number question, liquefactive necrosis is commonly seen in brain. True. 24 number, piglet anemia is always the macrocytic and normochromic. False. Actually piglet anemia occurs due to the deficiency of the iron, and whenever the iron deficiency is there, the anemia is the microcytic hypochromic type of the anemia. So 24 number answer is false. 25 number, bilateral complete urinary obstruction lead to the hydronephrosis. That is answer is true. 26 number, inability of the penis to come out through the prepuce is known as paraphimosis. Answer is false. उसको हम बोलते हैं phimosis. Means inability of the penis to come out through the prepuce is known as phimosis. तो 26 number answer is false. और paraphimosis को क्या बोलते हैं कि पेनिस जो है prepuce के अंदर की तरह रिट्रैक्ट नहीं होता है, उसको हम बोलते हैं पैराफिमोसिस. 27 नंबर, इन्फ्लामेशन ऑफ द स्टमक नोन एज स्टोमेटाइटिस. फॉल्स. स्टोमेटाइटिस मीन्स माउथ कैविटी और इन्फ्लामेशन ऑफ स्टमक हम उसको गैस्ट्राइटिस बोलते हैं. Now we will look forward for the multiple choice question or the objective type of the question, in which the first question is the leukocytosis with many immature neutrophil. Answer is A, regenerative left shift. Second number, protrusion of the lower jaw is called as prognathia. Answer is B. Third number, the remnant of the nuclear material that appear as a single or the double spherical bodies into the erythrocyte are the known as. Answer is Howell-Jolly body. Answer is C. Fourth number, sarcopharyngeal eclasia means particular. Answer is A, failure of the upper esophageal sphincter to relax. Fifth number, crowding of the oligodendroglia and the microglial cell around a neuron without inbinding is known as Satelitosis. Answer is B, satelitosis. 6 number, congenital fissure of the cranium is called as craniochesis, means answer is B. 7 number question, a muscular artery showing the necrosis and the calcification of the tunica media is called as, answer is B, medial sclerosis. 8 number, inflammatory cell containing the major basic protein toxic to the parasite, that is answer is D, that is eosinophils. 9 number, telescoping of the intestine, it is known as आंसर इज इनटू सक्सेशन. मैंने बोला ना इन्विजिनेशन, टेलीस्कोपिंग ऑफ इंटेस्टाइन, एक इंटेस्टाइन दूसरे इंटेस्टाइन के अंदर इन्विजिनेट होता है, उसको टेलीस्कोपिंग बोलते हैं. आंसर इज सी. 10 नंबर, फेल्यूर ऑफ द अल्वेलाई टू ओपन एंड द कंटेन एयर, दैट इज नोन एज एटेलेक्टेसिस. आंसर इज सी. 11 number, deposition of the calcium carbonate dust into the lung, that is known as siderosis. Answer is A. 12 number question, important disease of the sheep causing the shortness of the breath, that is known as MAD. Answer is MAD. 13 number, accumulation of the lymph rich in triglyceride into the thoracic cavity, that is known as chylothorax. Answer is C, chylothorax. 11 number में आंसर A है, याद रखना. 14 number, narrowing of the aorta is known as, answer is A, correction of the aorta. Answer is A. 15 नंबर है नोमा, ऑल्सो नोन एज द कैंक्रियम ओरिस. उसको क्या बोलते हैं? नोमा को हम क्या बोलते हैं? गैंग्रीनस स्टोमेटाइटिस बोलते हैं. क्या बोलते हैं? गैंग्रीनस स्टोमेटाइटिस इज नोन एज द नोमा. अब कुछ ज़्यादा स्पेसिफाई करना है, दैट इज द एक्यूट गैंग्रीनस स्टोमेटाइटिस इज नोन एज नोमा. तो आंसर इज ए. 16 नंबर है फेल्यूर ऑफ द लोअर इसोफेगल स्फिंक्टर टू रिलैक्स इन रिस्पॉन्स टू द स्वेलोइंग, उसको हम बोलते हैं एक्लेशिया. 17 नंबर, मार्क डायलेशन ऑफ द साइनोसॉइड इज नॉन एज टेलेंजेइक्टेसिस. आंसर इज सी. 18 नंबर, एक्रोमेगाली रिजल्ट ड्यू टू द, आंसर इज सी, हाइपरपिट्यूटरिज्म. 19 नंबर, माइक्रोसाइटिक एनीमिया यूजुअली रिजल्ट ड्यू टू द डेफिशिएंसी ऑफ, आंसर इज आयरन सी. 20 नंबर, ब्रोकन विंड इज ऑल्सो नॉन एज ह्यूस. Answer is B. 21 number, weight shaped necrosis is encountered in Rift Valley fever. Answer is B. 22 number, hobnail liver is seen in, answer is C, portal cirrhosis. 23 number, the abnormal ventral curvature of the spine, it is known as lordosis. Lordosis नहीं है, LORDOSIS है. You remember, answer is C. 24 number, individual having the both testicular and the ovarian tissue, that is called as, answer is hermaphrodite, B. 25 number, increase in the number of the digit, that is known as, answer is A, polydactylia. 26 number, heart failure cells is seen in, हार्ट फेल्यूर, नाम हार्ट फेल्यूर है लेकिन वो हार्ट में नहीं पाए जाते. यार रिमेंबर दिस थिंग, इट इज एक्चुअली प्रेजेंट इन लंग. आंसर इज ए. 27 नंबर, ऑस्टियोपेट्रोसिस इज ऑल्सो नॉन एज, आंसर इज सी. उसको हम, ऑस्टियोपेट्रोसिस को हम क्या बोलते हैं? ब्रिटल बोन भी बोलते हैं और मार्बल बोन भी बोलते हैं, क्योंकि एकदम वो कड़क हो जाता है बोन, इसकी वजह से उसको ब्रिटल बोन भी बोलते हैं और मार्बल बोन भी बोलते हैं. आंसर इज सी. 28 number, the phagocytic Gitter cell are derived from, particular, answer is A, microglia. 29 number, common type of the pneumonia seen in animal is particular, answer is A, bronchopneumonia. 30 number, twisting of the intestine on its mesenteric axis is called as, answer is B. 31 number, cystic dilation of the part of the oviduct, that is known as hydrosalpinx, answer is A. 32 number, lack of the pigment into the hair, that is, answer is B, that is leukotrichia. 33 number, inability of the retract the pupus or the glans penis, it is called as, particular, answer is paraphimosis. 34 number, continuous use of the horse for the production of the anti-sera usually suffer from the glomerulonephritis. Answer is A. 35 number, difficulty or the painful urination is called as strain urea. Answer is D. 36 number, anemia caused due to the non-functional bone marrow, that is known as, answer is C, aplastic anemia. 37 number, thickening of the alveolar wall is seen in interstitial pneumonia. Answer is C. 38 number, kidney in focal intestinal nephritis, that is particular, answer is B, white spotted kidney. Focal intestinal nephritis, white spotted kidney, you remember like that. 33 number, kidney in the subacute glomerulonephritis, that is, answer is D, large white kidney. Subacute means large white kidney, focal means white spotted kidney. Inflammation of the eyelid, that is known as, answer is A, blepharitis. 44 or 41 number, inflammation of the crop, that is, answer is B, inguinalitis. 42 number, in stage of the gray hepatization, answer is A, WBCs fill the alveoli. 43 number and last question, date of the fetus before the full term parturition, that is known as abortion. You remember here abortion, stillbirth and the mummification. Abortion में क्या हो, मरा हुआ fetus बाहर आता है, पार्चुरेशन जब पूरा नहीं होता उससे पहले, बिफोर द फुल टर्म ऑफ द पार्चुरेशन डेड फिटस कम आउट, दैट इज नोन एज एबॉर्शन. जबकि प्री मेच्योर बर्थ, उसमें क्या होता है कि बिफोर द एंड ऑफ parturition or the before the full term parturition, before the parturition live fetus will come out, that is known as premature birth. जबकि स्टिल बर्थ में क्या होता है, जब पूरा मतलब पार्चुरेशन का जो गेस्टेशन पीरियड होता है वो खत्म हो जाता है, उसके बाद जो फिटस डेड बाहर आता है उसको हम बोलते हैं स्टिल बर्थ. मीन्स डेड फिटस आफ्टर द फुल टर्म पार्चुरेशन, उसको बोलते हैं स्टिल बर्थ. Now we will look toward the match the following. Match the column A with B. सबसे पहला है incarceration, that is known as intestinal adhesion. Epistaxis, that is known as nasal bleeding. Hemopericardium, that is known as blood into the pericardial sac. Hydrosalpinx, that is known as the particular fluid in oviduct. Fifth number, cryptorchidum, that is considered as the particular hidden testis. Ranula, that is the salivary cyst, answer is C. Osteodystrophia fibrosa, answer is E, Miller's disease. Patency of the foramen ovale, answer is A, blue babies. Diplocardia, answer is B, 2 hearts. And hydrocele, that is answer is A, fluid into the tunica vaginalis. Now first again next make the following caries, that is answer is J, particular decay in teeth. Second number cystic ovaries, answer is particular J. G, nymphomania. Intestinal nephritis, answer is H, leptospirosis, जिसमें intestinal nephritis पाया जाता है. Lampas, that is the particular inflammation of the palate, answer is B. Pyometra, that is the shift to left, answer is C. Porter cirrhosis, answer is I. Hobnail liver. Cardiac cirrhosis, answer is D. Nutmeg liver. Glycosuria, answer is E. Enterotoxemia. Aneurysm means answer is F, that is the strongylis vulgaris. Hinge body, that is particular answer is A, phenothiazine toxicity. Now the various type of the inflammation is given and you have to match which type of the inflammation is there. Cheilitis means inflammation of the lip. Gingivitis, inflammation of the gum. Glossitis, inflammation of the particular tongue. Stomatitis, inflammation of the oral mucosa. Gastritis, inflammation of the stomach. Typhlitis, inflammation of the particular cecum. Proctitis, inflammation of the rectum. Cholangitis, you remember this cholangitis, inflammation of the bile duct, answer is D. And cholecystitis, inflammation of the gallbladder, answer is J. You remember the cholangitis and the cholecystitis, which are the most important. 10 number cystitis, answer is E, urinary bladder. Now certain condition is given on which another side which type of the condition will occur in particular aspect that you have to match. Choke, answer is A, esophageal obstruction. Cardiac tamponade, answer is A, fatal hemorrhage in heart. Third number, bread butter appearance, that is observed in particular heart in which a saggy heart. G, answer is G. Fourth number, teratology of the phalate, that is particular answer is B, anomaly of the heart. Fifth number, hairball, that is particular H, answer trichobezer, जिसको हम hair बोलते हैं। फुटबॉल जिसको हम फाइटोबेचर बोलते हैं, आंसर इज सी। हाइपरथायरॉइडिज्म, दैट इज आंसर इज पर्टिकुलर माइक्सीडेमा। 8 number, yellow fever, in which answer is mid-zonal necrosis, answer is D. Brown atrophy of the heart, answer is J. Severe cachexia or the aged animal. And 10 number, phlebolith, answer is particular vein, means vein के अंदर stone पाया जाता है। Now the particular condition is given in which you have to main. Roaring means answer is E. Paralysis of the left recurrent laryngeal nerve. Second number, Hughes, that is the C, answer is C. Chronic alveolar emphysema. Third number, mycotic pneumonia, that is answer is Aspergillus fumigatus. G. Pleurisy, answer is A. Inflammation of the pleura. Azoturia, answer is B. Monday morning sickness. Papule, the answer is D. Circumscribed elevation. Pustule means particular J, answer is J. Vesicle with pus. Coccytis, that is particular inflammation of hip joint. Gonitis, inflammation of the particular H, answer is stifle joint. And folliculitis, answer of I, hair follicle. Again the certain condition, which type of the condition is observed and which type of the condition is known as, we have to the match. Ophuritis, answer is H. Ovary, inflammation of the ovary. Orchitis, inflammation of the testis, answer is B. Intussusception, that is means telescoping of the intestine, answer is I. Torsion means twisting of the intestine on its axis, answer is J. Poikilocytosis means variation in the shape, answer is G. Anisocytosis, variation in size, answer is A. Microcytic anemia, answer is D. Iron deficiency. Macrocytic anemia, answer is C. B12 deficiency. And 9, cholelith means found the stone into the gallbladder, answer is F. Urolith, found the stone into the particular urinary bladder, answer is E. Now the certain condition of the related to the hormonal imbalance, you have to match. First is Addison disease, that is answer is E. Hypoadrenocorti answer is Addison disease, answer is E. Hypoadrenocortism. Second number, Cushing syndrome, that is answer is H. Hyperadrenocortism. You remember Addison में कम होता है, Cushing syndrome में ज़्यादा होता है. Third one, gingitism, answer is G. Hyperpituitarism in young ones. Acromegaly, hyperpituitarism in adult, answer is A. Third में G, fourth में A. Fifth number, diabetes insipidus, answer is B, in which vasopressin or the ADH deficiency उसकी वजह से होता है. Sixth number, diabetes mellitus, that is answer is C, insulin deficiency. 7 number, myxedema, that is particular observed in hypothyroidism in adult. Cretinism, that is a particular seen in due to the answer is J, hypothyroidism in young one. 9 number, dwarfism, that is answer is F, hypopituitarism. 10 number, pheochromocytoma, that is the tumor of the adrenal medulla. Tumor of the adrenal medulla. Now last make the following. First one, inflammation of that particular eye aspect. Cystitis, inflammation of that particular ciliary body, answer is H. Iridocystitis, answer is B. Iris and the ciliary body. Keratitis means inflammation of the cornea, answer is I. Fourth number, uveitis means answer is J. Choroid, iris and the ciliary body, इस तीनों का inflammation को uveitis बोलते हैं. You remember this. Fifth number, blepharitis means inflammation of the eyelid, answer is J. Orbital cellulitis, answer is A. Orbital का inflammation. 7 number, conjunctivitis, answer is D. Conjunctiva. 8 number, anterior syncytia, that is answer is C. Adhesion between the iris and the cornea. You remember this. And 9 number, posterior syncytia, answer is F. Adhesion between the iris and the lens. And 10 number, coloboma, answer is E. Abnormal notching of the eye structure. Now regarding the define the following. First one is the nutmeg liver. Second, cardiac failure. Third one, cleft palate. Fourth one, stillbirth. Fifth one, phytobagers. Sixth one, aplastic anemia. 7, hermaphrodite. 8, urticaria. 9, valvular insufficiency. 10, goiter. 11, amelia. 12, fracture. 13, arteriosclerosis. 14, noma. 15, blue babies. 16, hemolytic anemia. 17, atherosclerosis. 18, neurophagia. 19, abortion. And 20, azotemia. Now, after the completion of the part one, we have covered almost all aspect of the objective, which are the important for the systemic pathology in the part one objective part. Now we will see toward the part two subjective portion. First one is the long question. First question, define the pneumonia, classify the pneumonia and describe the stage of the lobar pneumonia. Second question, define the anemia, give its morphological and the etiological classification and describe the hemorrhagic anemia. Third number, define the cirrhosis and list the type of the cirrhosis and describe in detail about the portal cirrhosis. Fourth number, define and classify the nephritis, describe in brief about the gross and the microscopic lesions seen in glomerulonephritis in animal. Fifth number question, define the enteritis and list the type of the enteritis, describe in brief about the gross and the microscopic lesions seen in the chronic catarrhal enteritis, that is particular in John's disease. Sixth number, define the hepatitis, classify the hepatic necrosis and describe the central lobular and the paracentral necrosis. After the long question, now we will look toward the short notes. First is endocarditis, second one is traumatic reticulopericarditis, TRP, third number abortion, fourth uremia, fifth number what is the diabetes and the give a brief account on the diabetes mellitus. Sixth number, define the rickets and describe in brief about the rickets in animals. Seven number, define the azoturia and describe in brief about the Monday morning sickness. After the short note, some of the important difference is the following. First one is the red hepatization versus the gray hepatization. Second, diabetes mellitus versus diabetes insipidus. Third one, acanthosis versus hyperkeratosis. Fourth number, emphysema versus atelectasis. Fifth number, dry versus froth plot. Sixth number, rickets versus osteomalacia. Seven number, relative versus absolute polycythemia. Eight number, parenchymatous versus colloid goiter. 9 number, mummification versus maceration of the fetus. 10 number, suppurative versus non-suppurative encephalitis. Hope you people enjoy this video. Thank you for watching. I request you all to like, share and subscribe, and I request you to see at least once or twice to remember all the type of the objective, because of the reading revision, that is the most important aspect in every exam. Thank you and the best of luck for your exam. Thank you. We will meet in the next video regarding the unit 6 objective. Thank you once again.